Dr. Sani, we come across so many patients of hypertension who come to us and just with a one fit of anger, their blood pressure goes up. So, what is the relationship of stress? What is stressful life? Because you mentioned it is very high in urban areas. Are the lifestyle different? Do they eat more salt? Do they eat more saturated fat? Or they are obese? They have a pot belly? What are the main factors? Or they eat a lot of achar? They eat a lot of salted stuff, which are responsible. So, first important factor is stress. Please highlight on stress, sir.
Thank you, Dr. Chopra. Yes, you have said that the important contribution for blood pressure, as we discussed about white coat, one of the important reasons is the stress of coming to the clinic. उसके कारण उनको एंजाइटी होती है, हार्ट रेट बढ़ जाता है, बीपी सिस्टोलिक ब्लड प्रेशर बढ़ जाता है. So stress definitely plays an important role. Chronic stress is also coming up very important nowadays. What we see even younger population हमारे कंट्री में जिनका की स्ट्रेस लेवल बहुत बढ़ गया है बिकॉज ऑफ वेरियस रीजन. ड्यूरिंग कोविड टाइम भी हमने देखा उनका स्ट्रेस लेवल बढ़ गया. सम पीपल दे डू नॉट गेट एडिक्वेट स्लीप. I mean, they have sleep disorder, not only because of that, they have shift duties where they are not getting enough sleep. If the sleep is not good quality sleep, that also we have seen, not the obstructive sleep apnea, but as such sleep quality is not good, that also results in increase in blood pressure. So stress is definitely very, very important risk factor for high blood pressure besides the lifestyle problem which we are facing, particularly younger population now between 30s and 50s. जो हमने देखा है कि लाइफस्टाइल की सबसे बड़ी प्रॉब्लम में हमने देखा है sedentary habits. The recommendation है कि ब्लड प्रेशर को कंट्रोल करने के लिए we should have at least 5 days a week modest exercise, not very severe exercise, or per day you can say around 7,000 to 7,500 steps per day, and modest exercise is good enough. You do not have to have more than 10,000, but that is good enough. So the exercise will definitely help us not only in reducing blood pressure by a few millimeters. It improves your triglycerides, increases your HDL, improves the quality of LDL, reduces depression, improves sensitivity of insulin resistance, diabetes reduction. So all those multiple benefits हमने देखे हैं. Depression कम होता है, stress कम होता है. तो exercise is a very important part of management of the high blood pressure. Second is diet, as you rightly said, that in diet the people are taking too much of salt because people are in a habit of taking the food with a single button of phone. You get the food coming to your home, and those the fast foods are having high content of salt. So we should limit our salt, as the guideline says, to keep less than 5 grams per day. If you eat more than that, and for a blood pressure patient, it will increase the blood pressure. So salt intake has to be reduced to not more than 5 grams per day. Secondly, in diet, we now recommend that they should eat more potassium diet to reduce the blood pressure, and the potassium is present in the citrus fruits. So yeah, just a lemon ho gaya, coconut water hai, nuts and natural nuts hai, they are green vegetables, they are all having a lot of potassium, except for, and when people are using then in lemon water, they want to use the senda namak, but we have to be careful that if the patient has kidney disease, we do not advise them to have, because this contains more potassium. So except for those patients, those who are not having kidney disease, then high intake of potassium will definitely reduce the blood pressure in this population. Then we also strictly avoid sweet and sugary beverages, the aerated water, the artificial juices. So we suggest that to take lemon water, coconut water, or lassi, and type of beverages which are more healthy food to be taken. And third, very important, is the tobacco. The tobacco consumption, both the smoking as well as chewing tobacco, both are important causes of high blood pressure. And finally, I will say alcohol consumption. Many people, they ask us, alcohol, we have learned that if you take alcohol in a large quantity, definitely it increases blood pressure. Binge drinking not only increases blood pressure, but also results in arrhythmias like atrial fibrillation. So what we suggest, a modest drink, social drink is the best way to go. And that is that less than 2 drink or 150 ml or maybe 5 ounces of wine or maybe 1 pint of beer. But for women, hum kehte hain, uske intake should be half of the men, because they lack the enzyme to metabolize the alcohol. So if you follow a lifestyle modification as a whole, then a significant number of patients will able to reduce their blood pressure without pharmacological treatment, without giving any drug. So look at the people, those who are obese. If you reduce the blood, their body weight, they will reduce the blood pressure also. So all those factors are very important to control blood pressure by lifestyle modification. And stress के लिए कई बार हम suggestion देते हैं, meditation करिए, yoga exercise करिए. They are very useful, particularly in those patients, those who are chronically stressed.
हेल्थ, फिटनेस और पोषण पर पाए बेस्ट डॉक्टर्स की राय सिर्फ famhealth.in पर, और हमारी YouTube पेज माय फैम हेल्थ पर सब्सक्राइब करना ना भूलें।